Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hello everybody, I'm the Millennial Mechanical Therapist, and today we're going to have a little bit different conversation than we have for the past couple weeks. Lately I've been bringing to light a couple different scenarios of spinal cases, extremity cases, where we've seen big changes, quick changes, or maybe even just how patient education has gone so far. Unfortunately, what we're coming to with today is what I consider a loss. Today's patient is a little bit different than normal, a little bit more of a serious tone. If you go back, we talked about McKenzie and how MDT assessment and being mechanically minded really helps you find red flags. Well, this older woman came in my office about a week ago with pain of left-sided head around her ear and neck, quote-unquote, crunchiness. She did have some very audible cracks, snaps, and pops when she moved her neck from side to side, which was very alarming to her. To dive more into her eval, the woman was over 70, had progressively worsening symptoms, and did have intermittent numbness and tingling along the same pathway of her left-sided ear and base suboccipital area only on the left. She had issues, gross loss range of motion in all directions. Constant symptoms, but there were things that made it worse, like bending, sitting, turning heads from side to side, and lying specifically on the left side. Nothing really made it better besides not moving it. And that really just calmed down some of the symptoms, not necessarily made it better, because she constantly had it, which, as we dive further in the objective examination, changed a little bit. But just to take a second to focus on some of the information I just gave you, she's over the age of 70 and has a new type of neck or head pain that's been worsening for a year. That's not good, and I knew that. To give you a little bit of a side note on her as well, she pretty much came in, and I know everyone's had a patient like this, and said, I don't know why I'm here, I'm not sure this will work, pretty sure it won't work, nobody can help me. So her doubts really didn't help either. But when someone comes to me like that, I usually explain to them that within 3 to 5 visits, if they give me 3 to 5 visits, I will be able to tell them if I can even help them. And usually within that time, people feel much better, and some people are even gone by that time. So, and I asked her to at least give me the 3 to 5 visits, and she agreed. She agreed with giving me 3 to 5 visits, so that was at least a step in the right direction. We go through the objective information, and just postural correction decreased the symptoms around the ear. That was huge. And I showed her, I let her slouch, it came on, I had her sit up and it went away, slouch came on, went up, decreased. That is huge. If posture can just show that big of a difference, then usually you can expose these things for a derangement or a dysfunction or a postural syndrome in that case. But postural syndromes and dysfunctions are typically local. We'll get off, that's a side note. You can look that up if you read the textbooks, that is. So postural correction decreased her head symptoms. She really wasn't even that impressed, which blew my mind, because in her mind it's been constant for a year. And yet this didn't even phase her. Whatever. As we go in repeated movements exam, we find that repeated retraction, and specifically repeated retraction with overpressure, almost totally abolished. So decreased, just not abolished, but decreased to a point where that really wasn't there, but increased a little bit of the left-sided suboccipital pain. I educated her on centralization, peripheralization. I even drew her a specific chart of the common centralization symptoms I've seen when it comes to headaches. She seemed like we were on the right track. Day 2 comes around, she's not happy with me. Nothing's changed. She explains that she's been diligent with her home exercise program, but nothing has changed. But I do believe she said, no, nothing's changed. So we go through, nothing's changing. She's still alarmed about the snaps, the cracks, the pops. Nothing I can do makes her happy. But she seems committed to wanting to give this a shot, which at least was a step in the right direction. We settled on retraction flexion with overpressure and supine, which seemed to yield the biggest result. I believe we abolished the head pain and only had neck pain. And I left her and sent her home with that, and she probably did about 40 of those, and she felt very comfortable with doing them. So here's where the story gets a little more interesting. Today I get a phone call from her, and she does not want to come to therapy. She's canceling her appointment for today. She doesn't think it's helping, and she's tired of doing the exercises. She wants to do nothing and says she's just going to avoid the things that set her off, which isn't bad. I educated her on posture, on please coming in. I really wanted to see her, at least assess her. I told her that we agreed upon 3 to 5 visits. This is only today would have been the 3rd. No. So I educated her, and then I just told her that she should follow up with her physician. Due to that beginning, going all the way back, she's over the age of 70 and has progressively worsening new symptoms of the head and neck. That's not usually a good thing. Those are red flags, and she hasn't received any imaging or anything like that. So I was hoping that they could go down that route. She agreed. Done. I'm upset because I take every patient like this 100% personal. In my mind, I didn't educate them enough. I wasn't able to get through to them. I wasn't able to show them the wow effect if it was truly a derangement. Do I know if it was truly a derangement? If that was the correct classification? Maybe I was chasing it. It wasn't. Maybe it was a non-mechanically neck pain. Although it had small mechanical changes, maybe none of them were lasting, and it truly wasn't a derangement, an internal disruption of the joint surfaces. I don't know. I wasn't able to classify her quick enough, and I take that to my fault. But this is where I think the McKenzie system, mechanical diagnosis and therapy, is huge. Everyone loses patience. Sometimes you just don't jive with people. Some people don't like you. I'm a very upbeat individual. I want to help. Some people don't like that. Some people might not like you. But no one can ever take from me that I didn't do my darnest try and classify them to help them help themselves. No one can take that from me. This woman may not be mechanical. Maybe she is, and it was just too stubborn for us to figure out in 2 visits. Maybe that's where my shortcomings are right now. And that's for me to grow on and reflect upon. But she can't take that from me that I tried my darndest in those 2 visits to help her out and get her to centralize and abolish that head symptom. I hope she does well. I hope nothing happens ill with her. I hope she follows up with her physician. We'll see. Maybe I'll find out sooner or later. But the beauty of the system is if you're mechanically minded, if you're following patient-generated responses, if you're doing your due diligence to your patients and really trying to help them, maybe we would have found that she wasn't mechanical. And then I would have sent her off because of those red flags. But to treat her for a month, rubbing her neck, strengthening, what good would that do her? She didn't have a weak neck. She needed to be rubbed. She needed to find out if she had mechanical neck pain or if she needs to be screened by someone with other skill sets. My friends, this is why being mechanically minded, going through the MDT assessment, is helpful, even when you lose. Although I'm down on myself because I lost a patient, I take it personally. I have to realize that this is the way of the world. This is what we do. We're going to lose some people. Can't always win. But I wanted to show you guys that there are losses out there, but a loss isn't necessarily a bad thing. Failure isn't the end. It's growth. Helps you learn, helps you reflect. My friends, I will see you soon. Wanted to share this one with you today. A little bit longer than normal, and I'm sorry. Follow us on Facebook, Twitter, Instagram. You'll see her eval sheet up with this video as well. I look forward to hearing any comments or questions. Let me know. Move your patients early, move them often, and move them to end range, because that's where the magic happens, my friends. Until next time, we'll see you.